Good evening and welcome to our COVID-19 update. I am Ladi Akiriduluale. Here are the highlights at this hour. Federal government warns yet again about low compliance to COVID-19 prevention protocols, cites Brazil as a cautionary tale. Domestic flight operations restart coming. Dry run in Lagos and Abuja airports to be done on Saturday. Europe and America experience surge in COVID-19 cases as more countries ease lockdown measures. We begin tonight from Abuja and today's Presidential Task Force on COVID-19 briefing, where its chairman, Mr. Boss Mustafa, says the country must learn from what is happening in other countries concerning COVID-19. The secretary to the government of the Federation, citing Brazil as an example, says if Nigerians continue to disregard protocols and prevention guidelines, the results could be drastic.
Particular concern, however, is the case of Brazil, which has exceeded the 1 million mark of confirmed cases, with over 50,000 fatalities. We have informed you that Brazil shares several cultural, demographic, and climatic affinities with us. If any lesson is to be learned, Brazil should be a subject of interest that will make us change our behavior. In furtherance of the collaboration with subnational entities, the Presidential Task Force joined the Nigerian Governors Forum and the NEC. I wish to inform you that by the end of this week, the Presidential Task Force will be submitting a report containing our assessment and recommendations to Mr. President for his consideration. We therefore urge Nigerians to await our recommendations regarding the next steps of action to be taken in our national response to COVID-19.
Meanwhile, the national coordinator of the PTF, Dr. Sonny Ali, says after several months of confirmed cases, deaths, and recoveries, for anyone to still be doubting the existence of COVID-19 is unfortunate. Dr. Ali emphasizes that to continue to express disbelief is a service to the memory of those who have lost their lives to the virus.
We are aware that many Nigerians do not believe that COVID-19 is real. Many think that it is a scam or a ploy to access funds meant for public welfare. Some do not believe it's real simply because they have not seen or do not know someone who has tested positive for COVID-19. But tell me, how many of you have seen a case of Ebola? How many of you have seen even a case of Lassa, or even some of the more sort of common infections? You do not need to come across a patient with a life-threatening transmissible infection before you believe in it. There are people who do not believe it's real because they are not seeing the sort of high number of deaths or the health crisis that is currently occurring in many parts of the world. But our numbers are already increasing. We don't want to reach that stage. But if we don't want to reach that stage, we have to take those measures that are necessary to protect ourselves and our loved ones. A reasonable number of people still believe it's a disease that affects other countries but not Nigeria. Well, I'm afraid we are all humans in Nigeria. There's nothing special about us that provides us with resistance against COVID-19. None. As the chair said, our climate is very similar to that of Brazil. The health system is much, much more sophisticated than that of Nigeria, but you can see the sort of problems they are currently facing. We must We must start believing in COVID if we are to protect ourselves from this infection.
Flight operations on the domestic front now look more feasible and likely since many, though not all, gaps previously identified have been filled. The Director General of the Nigerian Civil Aviation Authority, the NCAA, Captain Musa Nuhu, gave this indication at today's PTF briefing. He says a dry run of operations at the Lagos and Abuja airports will be conducted on Saturday, the 27th of June.
I would like to report that we've had significant progress in the readiness of the industry to restart. The gaps have been closed, but however, we still have a few gaps within the aviation ecosystem, and this will be closed hopefully in the next couple of days. I've said it, and I'll keep saying it, we must get it right the first time, both on the issues of technical safety and health safety of all stakeholders. And one of these things we're going to use to close some of the gaps is a dry run test of both Lagos and Abuja airports coming up this Saturday. After this dry runs, we'll have a look, observe, and see the gaps that might still be there, and we'll close them. After that, we will announce a date of restart shortly, sometime next week.
Now, health authorities have indicated approval of a national strategic action plan on COVID-19. That comes from a virtual meeting of the National Council on Health held earlier this week. The Minister of State for Health, Dr. Oloronimbe Mamora, says with this, a cohesive response strategy is to be implemented.
The Council approved the National Health Sector COVID-19 Pandemic Response Action Plan, which was developed by the Federal Ministry of Health in collaboration with departments and agencies to present one response in the health sector delivered in a coordinated and strategic manner. As we learn more about the disease, we continue to evolve response actions. The community transmission has resulted in a high number of confirmed cases, with the challenge that in some states, the facilities for case management may become overwhelmed. Bearing in mind the importance of managing cases in facilities, the Federal Ministry of Health, through the National Primary Health Care Development Agency, has developed a guideline for the establishment of community support centers where desirable. A central objective of this guideline is the establishment of community support centers in selected clusters of local government areas for the management of COVID-19 cases.
The relatively new practice of wearing face shields without face masks does not protect against COVID-19 infection or transmission. The Director General of the Nigeria Center for Disease Control, the NCDC, Dr. Chikwe Ihekwezu, revealed this at today's PTF briefing, where he explained that both face shields and face masks must be worn together for effective protection of the wearer. Dr. Ihekwezu also spoke about the symptoms of COVID-19, particularly the loss of the sense of smell and taste.
And over the past few weeks, there have been a lot of discussions over the role of the loss of smell and taste as symptoms of COVID-19. These have been recognized globally as symptoms of this disease. There are very few other diseases that would cause a sudden loss of taste or smell, especially in normally otherwise healthy individuals. So it's most likely that this is linked with an increasing incidence of COVID-19. So we would expect that this should also lead to increased presentation at clinical facilities and increased testing. So this is just to make it clear to Nigerians that if you do feel that you're losing your sense of smell or taste and taste, this has been recognized as a symptom of COVID-19. You should be presenting yourself and for testing. We will, all over the country, there are people there available to test you through the state's public health infrastructure and in order to rule in or out whether you have COVID-19. Secondly, there's been an increasing use of face shields to apparently protect you or the population from the transmission of COVID-19. And today, I'd also like to advise that face shields are great, but they should be used in addition to face masks.
There was no point at which the Ministry of Education at the federal level said it was not working on how schools could survive in the COVID-19 era, and any statement to the contrary is false. The Minister of State Education, Emeka Wajuba, told the PTF briefing today in Abuja that it is important to know what is at stake, particularly with children.
Coronavirus is real, and we've been meeting over this and working to strengthen our response to this pandemic. However, to be clear, I did point out that part of the reason why we are keeping our children at home stems from the fact that you can't see this coronavirus with your physical eyes. So you may not know if a child is asymptomatically carrying this. And if he or she so does, and then goes back home and infects another person, there's no way for us to guarantee. And besides, that the ministry had prior to now conducted a perception survey around the country. And we know that 80% of the responses we got from around the country were assurances from parents that they are not willing to experiment with any of their own children. If there are people who are interested in using their children to experiment to check whether it can work or not, we can invite them to test.
And in spite of the sensitization carried out to curb the spread of the coronavirus, the use of face masks and the observance of physical distancing are gradually diminishing in most parts of the public in Yobe State. Channels Television's visit to the markets, mosques, and churches indicate that only 2 of 10 persons are putting on face masks, while hand-washing facilities are almost absent in most of those public places.
When you visit some parts of the country, the sense you get from some provinces and area by the way people interact, it's a completely oblivious or nonchalant disposition to the dangers of COVID-19.
Not actually, you can see that I'm not having a face mask. Everyone here doesn't have a face mask because the COVID-19 is not actually the problem. It is hunger that's the problem.
From the corridors of various government authorities, there's no denying the efforts at sensitizing the citizenry on the safety protocols to embrace. But all of that has not received a commensurate response by way of action by the populace.
The committee also realized the need to reduce the risk of transmission of the disease. And following analysis of studies, we now came up with the recommendation. Initially, it was a recommendation for the use of face masks by each and every person before they leave their houses. This recommendation was made mandatory afterwards when, in addition to that of Yobe State, the federal government made made it mandatory for everyone to wear their face masks. And as such, Yobe State keyed into the directives of the federal government of Nigeria.
Gaskiya abun dai As a matter of fact, I know the face mask and other personal protective equipment can help, only that we're in poverty. I think getting good food to eat is my first priority. Other things follow.
The non-monitoring and enforcement of the directives by the relevant authorities is also another big challenge. Yobe State has so far recorded over 60 confirmed cases of the COVID-19, and the committee need to work harder to create more awareness before the virus goes into community transmission.
And some of the impact of the non-compliance you just saw there is that 649 confirmed coronavirus cases were reported in the last 24 hours from 22 states in Nigeria, bringing the total number of confirmed COVID-19 cases in the country to 22,020. According to the COVID-19 situation report published by the Nigeria Center for Disease Control, the NCDC, 7,613 patients have been discharged and 542 fatalities recorded, bringing the total number of active cases in 36 states, including the FCT, to 13,865. The report also indicates that over 122,000 samples have been tested, and the demographics show that the infection rate is more in the male gender, which accounts for 67%, while the female is 33%. The most affected age group remains those between the ages of 31 to 40 years. So far, the top 3 states are still Lagos with 9,323 cases in all, the FCT at 1,622 cases, and Kano with 1,191. These states are leading in their respective regions and also recorded a higher number of recoveries. River State leads in the South-South with 930 cases. Bauchi is top in the Northeast at 488. And in the Southeast, Abia has recorded 280 confirmed cases. When we come back after the break, we'll be taking a look at how the COVID-19 pandemic has impacted on the entertainment subsector. Please stay on with us. Thanks for staying tuned. Welcome back to the COVID-19 update. Now, the pandemic has hit a lot of industries across the world. In Nigeria, the tales are the same, and particularly more hard-hitting for entertainers and other practitioners within the show business world. The approved protocols for curbing the spread of COVID-19 means it is now impossible for entertainers to continue business as usual. Our correspondent, Abidemi Dairo, takes a look at some of the effects the disease has had on the showbiz industry in Nigeria.
Motion pictures, sound recordings and music productions grew by 0.81% in the fourth quarter of 2019. This is according to official figures from the National Bureau of Statistics. In monetary terms, the Federal Ministry of Information, Culture and Tourism puts it at over $100 million revenue from 2019. Pretty much a good place to start the new year for the industry. The unforeseen outcome of a pandemic, which has now crippled all activities in many states of the country, including Lagos and Abuja, means the Nigerian creative industry, with all of its potentials and impressive momentum, has come up against a brick wall. Entertainment and recreational venues are closed. Concerts and premieres have been cancelled, and the theaters are now a shadow of their rejuvenated vibrancy with the lights out.
Nothing should stop you creatively. If you had albums and records to put out, South Sultan put out his album this period, you know, and I know a lot of people that are putting out material. My good friend AQ also put out an album recently, and more people are queuing up to just drop albums and drop singles. And I know people that are releasing books as well, writers that have brought out books and are dropping PDF editions, or they're dropping editions that you can basically download, you know. So nothing should stop you.
We don't even know what's going to happen. I'm sure lawyers and everybody would be ready to resolve things. Why? Because people have booked us. They've paid. And they've secured their dates, but this is happening now. And then when this is all over, they're going to shift to another date, and there's a likelihood that someone has that date already.
Yeah, okay.
And nobody's going to refund anything. We have a non-refund policy.
Although the lockdown is gradually being eased, so much uncertainty still hangs around entertainment activities. A drive-in concert headlined by Naira Marley in Abuja eventually fell on the wrong side of the law. The creative industry is believed to be the second largest employer of youth after agriculture. The fate of the industry post-COVID-19 now hangs in the balance. Abide Midairo for Channels Television News.
Joining me to take a further look at this are two practitioners in that particular part of the industry. In the studio with me here, I have Mr. Harrison Okiri, popularly known as Harry Song. Nice to have you with us.
Thank you.
Thank you for coming in. On the other side of the studio, we're joined by Mr. Matthew O'Hill. I hope that's correct.
Yes, sir.
He is a show promoter. Thank you so much for being with us.
Thank you.
Let me begin with you, Harry Song. One of those who was speaking in that report there points out that, look, the fact that there's COVID-19 doesn't stop you from doing things.
Yeah.
But it does stop you from doing things traditionally, doesn't it?
Yes.
So what plans do you think people should have now for making the switch to what is now seeming like it's going to be here for a while?
For a while. I know this, we didn't really prepare for what we are facing right now. And it's not about Nigeria or Africa alone, it's the world, you understand? And it has affected us in many ways when it comes to events, shows. Like one of my colleagues said, they've booked us. We had dates already for some of the months that has passed already, and we're all at home. And the thing is, one has to re-strategize, which I know some of my colleagues have done already. That now you have to record songs, put out singles, and monetize your content online so you can still feed family, pay bills, and keep the business going. Because if you come to think of it, it's wider when you really build online and focus online. Because for the shows, you just have a venue, and anybody that buys that ticket comes to that venue and watch you perform, and they connect with you. I know fans love that, but when it has to do with the social media platform, as wide as you can sponsor your content, that's how far the content can go. So the audience is wider when it's online. So it does not really have to stop you because you are not performing shows as a creative person. That means you can't make money. No, you can monetize the content, put out albums, put out singles. You have a team, you have a management. There are distribution companies that are chasing us right now to get new and brand content. And better for us, the music has changed because people are home now and people are listening to music. People want to hear good lyrics. People want to, you understand, there are no clubs to dance, to get crazy, and you understand. So people are home, they settle, they want to listen to good music. As much as the tempo has dropped from maybe 100, 130 to like 70 and 50, it's better for writers and creative people to really settle down. I've never enjoyed music like I've enjoyed in this period of COVID-19, I must confess. Because now we're not flying here and there, we're just home. So you have all the time to really settle down, write and create and score good music.
Let me come to you, Matthew, and ask, I mean, you're a promoter, so you juggle services. You put people like Harry in touch with their fans and those who want to hear and see them. Now, he talks about the fact that being online is a good thing, but doesn't that kind of put people like you out of work, essentially?
As a show promoter, it's a bit different for us because our business model thrives on human interaction and large gatherings. This virus also thrives on human interaction and large gatherings. We're trying to innovate, go virtual, do the drive-in concerts, but with the virtual platforms, they're not as engaging. They're not as lucrative for artists, for show promoters to go on there. So it's a very different situation when it comes to show promoters.
But that doesn't mean that you, like Harry pointed out, that doesn't mean you won't innovate because somehow you've got to survive. So I guess the next logical question would be, what are you doing in that regard? Because it doesn't look as if COVID-19 is going anywhere very soon.
Yeah.
So, and you've got to survive in the meantime.
I mean, we see a lot of people doing virtual concerts. We see a lot of people doing Instagram concerts, e-concerts. But to be honest with you, my business model is we sell tickets, we sell food and drinks, we sell sponsorship. For the sponsors are not, they're not interested in having virtual concerts because most of these sponsors are consumable, like alcohol beverage companies. Alcohol beverage industry is kind of like responsible for like 70% of all the concerts, the shows you see in a year. And for them, these virtual concerts, these e-concerts are not that engaging. They can't showcase their products. People can't consume their products. So it's a different ballgame when it comes to show promoters. We do these virtual concerts to kind of like maintain brand relevance, to keep the artist connect Harry Song with his fans. But the business aspect of it is not yet hacked.
I'm happy you mentioned the business aspect of it because I'm going to ask Harry here. One of the things that immediately comes to mind when you talk about online and all that is some form of piracy. This is a problem that we've been dealing with in the Nigerian context, in reality, on the ground. Even when the products were there, people steal them and they go and mass produce them before the artists can even make anything. Isn't that a real concern for you during this period? Harry?
For me, we already have that as a problem, as a challenge. It's a very big challenge for us because we don't have control, total control over the content. Piracy is heavy, and we've been crying to the government for that. And I think they've not yet seen how important it is to focus on the entertainment industry, to have invested in the entertainment industry. It's a big challenge for us. Now we are faced with more heavier challenge that if these contents were better monetized and there was like a umbrella, a platform, it would have been easier for us to say, okay, entertainers can sustain and still maintain what they do and still make money. But now, when it's online, a lot of people just go and download the songs and put it out. So it still boils down to the fact that we cannot wait for this COVID-19 to be over to get back to normal because even when we make money online with views and downloads, come on, when a show promoter calls you and say you are doing Port Harcourt, Enugu, Bayelsa, Abuja, you need to see the excitement in our faces to know, because that money is a blessing. It keeps you walking, and on the road, on the spot, you know what's banging, you know what's happening. Then you now know the next song to record. You understand. So we are caught out of a lot of things when it comes to the content, shows, and income. So right now, I don't think the government is even seeing the entertainment industry as where they should, as that place that they should focus on, to engage the youth more and, help control piracy, because right now they're focusing on trying to control the COVID-19, right, handling the situation of what we have now. So it's all man for himself, if I can say. Do you understand? It's all man for himself, if I can say. So it's a problem for us.
Matthew, let me come to you and ask, therefore, I mean, you've talked about the fact that your business model has been completely disrupted by this. And Harry has just talked about the fact that government does not seem to be looking in that direction at this point. Which brings up the question, other sectors have demanded for and are expecting palliatives, those in manufacturing, in aviation, and so on. And at some point, we did hear that entertainment was also in the mix. Has anything come of that you are aware of?
Well, there was a questionnaire being passed around to try to gather information on how people have been affected. I think Alibaba, Ifeomorigbe were part of that information gathering process. But nothing has really gone past that for now, as of now, you know.
Well, we'll be keeping an eye on this, gentlemen. Harrison Okere, Harrison, thank you.
Thank you
for
so
coming
much
up.
for
And
having us today.
Matthew O'Hale, thank you so much for your time, both
Thank
of you
you.
gentlemen. One can only wish you the best of luck in this transitional period for entertainment. And we have no doubt you will be back here to tell us about how it's going sometime in the near future. Thank you so much for your time.
Thank you.
Nasarawa State residents have been pouring out their minds over the amount spent by the COVID-19 task force to curb the pandemic in that state. The Deputy Governor, Dr. Emmanuel Akabe, earlier declared that his team had spent 536 million naira. Our correspondent, Halima Gayam, has those details.
State government is giving account of funds spent so far in the management of COVID-19 in the state. The chairman of the state task force and the state deputy governor, Dr. Emmanuel Akabe, told journalists that over 536 million naira have been spent so far. Out of the 536 million naira, 112 million naira were donations from private sources.
You must agree with me that what was spent so far compared to what we could achieve in Nasarawa State is very small. And Nasarawa State being very close to the FCT, I keep saying it, whatever affects FCT affects us in Nasarawa State, particularly in the Karo axis. That FCT is recording over 1,000 positive cases, and we're recording only 200 in Nasarawa State, means that our people have really, really worked.
But how are the people reacting to this?
Well, it was fine. I'm very convinced, considering the level of awareness, the level of facilities on ground, and the provisions of palliative, to be precise. They did the very best.
I'm not satisfied, right? Because since that, I don't even know where the money is going for.
Much still needs to be done in terms of awareness, as people still flout safety protocols in the state, despite over 200 confirmed cases. Halima Gayam for COVID-19 Update.
All right, thank you, Halima. Let's take a more medical perspective of all of this now. And joining me in the studio to look at not just COVID-19 response, the entertainment industry and how it can possibly respond to this is a consultant public health physician, Dr. Doyin Oguyemi. Dr. Oguyemi, as always, thank you. Welcome.
Thank you for having me.
Let's start off with the entertainers. I'm sure you listened to them. Their entire value chain has been upended by COVID-19. But the truth is that going forward, they will have to adapt. In terms of health precautions, in terms of the health perspective of it, is it ever likely that we're going to go back to seeing stadium filled with fans for a music concert and so on? Is there a likelihood that that could ever happen?
Yeah.
Anytime soon?
Not anytime soon. So we must acknowledge the role the entertainment industry plays, even in our health. Our mental health, our social health. You know, health is that total well-being, not just that physical health. Okay. And so entertainment is part of why we stay mentally healthy and emotional wellness, and we have less depression and suicides and some other things that can come with loneliness.
Right.
However, these are not normal times, and therefore we have to adapt. Let's not forget that several years, 100 years ago, we had the Spanish flu, and the world came out of it, and we're here again. So it's still a bit of us bearing a little more in terms of restraint. When it comes to entertainment, three things entertainers and events planners must always consider, three C's. First is the confined spaces. Okay. Avoid confined spaces. Secondly, you want to avoid close contact. Thirdly, you want to avoid crowded places. So during this time, you know, unprecedented time that we are in, we must look at those three areas when events are being planned. At the moment, we still have to follow the government guidelines, and that has not been eased yet for large gatherings. When, there's such easing, or when we even have to organize events, we have to put these things into consideration for everybody's safety. There are things people can do. If you have very large gatherings that must involve human-to-human interaction, jams where, there's just no way. It's about that atmosphere.
Indeed.
Otherwise, it is not it.
The COVID-19 pandemic. Please go to those websites, particularly channelstv.com, where you also find news of other happenings apart from COVID-19 in sports, in business, and of course, in health. I'm Ladi Akiri Duluale. Thank you for watching tonight's COVID-19 update. Good night.